A 75-year-old patient is admitted to the emergency department with a suspected hip fracture after a fall. The nurse performs an assessment and notes the patient's leg appears shortened and externally rotated. What type of fracture is most likely present? A. Green stick fracture. B. Comminuted fracture. C. Spiral fracture. D. Hip fracture. The correct answer is D. Hip fracture. Explanation. The question describes a hip fracture with the leg appearing shortened and externally rotated, which is a characteristic of this type of fracture. A green stick fracture, option A, is a fracture common in children due to their pliable bones. Option B, a comminuted fracture, involves fragmentation of the bone into multiple pieces. Option C, spiral fracture, involves a fracture line that spirals around the bone and is commonly associated with twisting injuries, but it does not typically cause shortening and external rotation of the leg. A 30-year-old male presents to the emergency department with a fractured arm after a fall. The nurse assesses the patient's arm and notes crepitus, swelling, and tenderness over the fractured area. The nurse suspects a closed fracture. Which of the following interventions should the nurse prioritize? A. Applying a cold pack to the fracture site. B. Immobilizing the fractured arm with a splint. C. Administering analgesics for pain relief. D. Assessing the neurovascular status of the affected arm. The correct answer is D. Assessing the neurovascular status of the affected arm. Explanation. The patient's signs and symptoms indicate a closed fracture, which refers to a fracture where the skin remains intact. Assessing neurovascular status is the priority intervention to ensure adequate blood flow and nerve function to the affected arm. Options A, B, and C are important interventions but are secondary to ensuring the patient's neurovascular status is intact. A 16-year-old athlete is brought to the emergency department with a suspected stress fracture in the foot. The nurse is providing education to the patient about managing the condition. Which of the following statements by the patient indicates an understanding of the nurse's teaching? A. I will continue my regular training routine to strengthen my foot. B. I will take ibuprofen regularly to reduce the pain and swelling. C. I will use crutches and avoid putting weight on my foot. D. I will apply heat packs to the affected area to promote healing. The correct answer is C. I will use crutches and avoid putting weight on my foot. Explanation. Stress fractures are overuse injuries that occur due to repetitive stress on the bone.